Good day, students. Today, we're going to discuss a clinical case that will help us understand the potential causes of anuria, which is a condition characterized by the absence of urine production. Let's dive into the case. We have a 56-year-old man who has come to the emergency department with a 2-day history of fever, cough, and shortness of breath. His physical examination reveals a temperature of 101 degrees Fahrenheit, a respiratory rate of 24 breaths per minute, and a blood pressure of 90-60 millimeters of mercury. His chest X-ray shows a right lower lobe infiltrate. The question we're trying to answer is, what is the most likely etiology of anuria in this patient? We have several options. A. Complete bilateral obstruction of the urinary tract. B. Vascular events such as dissection or arterial occlusion. C. Renal vein thrombosis. D. Renal cortical necrosis. E. Severe acute tubular necrosis. Let's go through each of these options and discuss their likelihood based on the patient's presentation. A. Complete bilateral obstruction of the urinary tract. While this could theoretically cause anuria, it's unlikely in this case. The patient's symptoms and chest X-ray findings suggest a respiratory infection, which doesn't typically lead to a complete obstruction of the urinary tract. B. Vascular events such as dissection or arterial occlusion. These events can indeed lead to anuria, but they would typically present with acute abdominal or flank pain, which our patient does not report. C. Renal vein thrombosis. Renal vein thrombosis could cause anuria, but it's more commonly associated with nephrotic syndrome, which our patient does not seem to have. D. Renal cortical necrosis. This is a severe form of acute kidney injury that can cause anuria. However, it's usually associated with conditions like severe sepsis or obstetric catastrophes, which don't seem to apply to our patient. E. Severe acute tubular necrosis. This is a common cause of acute kidney injury and can lead to anuria. It's often caused by severe illness or infection, which could fit with our patient's symptoms of fever, cough, and shortness of breath. Conclusion based on the patient's symptoms and the typical presentations of the conditions listed. The most likely cause of anuria in this patient is severe acute tubular necrosis. This condition can occur when there's significant damage to the kidney tissue, often due to a severe infection or illness, which aligns with our patient's presentation. Remember, in clinical practice, it's crucial to consider the whole patient and all their symptoms when trying to make a diagnosis. This case is a good reminder of how different systems in the body can impact each other.